trying to take me on time straight. Come here. Try to video me. I was struck fine. Do what he thinking. Okay, I'm good.
Zelda, by the way, how many pounds have you lost as a result of getting healthy?
25.
25. Now we have a record of you just a couple months ago getting up off this table. Marlon was helping you at that time. I want to see if you can get up off that table by yourself today and how you look when you do so. Okay? Dr. Tanner, let's get a film of that.
Okay.
Oh yeah, looking good.
Stand on up there. Now is that a difference or what?
Oh yeah, let's get a walk here. Hold on.
I can't walk.
You can't walk now.
No, I feel so crazy. I feel very crazy.
Go ahead. Hi, this is Dr. Paul Goldberg with the Goldberg Clinic. I have the pleasure today to be with Miss Zelda Gould. Zelda came to us in January of this year, in 2013, with the medical diagnosis of what, Zelda? What did they told you?
Rheumatoid arthritis.
They had told you you had rheumatoid arthritis, and you had gone to a rheumatologist. Is that right?
Yes.
Had gone to a rheumatologist. Can you tell us a little bit about how you felt when you first came to see us at the Goldberg Clinic?
I felt really bad, really bad. I was unable to pretty much do anything for myself.
What kind of symptoms did you have at that time?
I had pain throughout my whole body.
Yeah.
I was unable to bend, lift, sit by myself, or even stand up without having assistance.
Yeah, and you have a good husband that was helping you too. Yeah, but it was still very difficult for you at that time.
Yes.
Yeah. What kinds of treatments had you been on, Zelda, prior to coming here?
I was taking 50 milliliters of Embryo injections once a week.
Which is an immunosuppressant biological drug. Okay.
I was taking prednisone.
Prednisone.
And my folic acid, of course, along with my methotrexate once a week.
Okay, so you were on methotrexate, which is a disease-modifying rheumatoid drug, and you were on steroids in the form of prednisone, and you were taking a biological drug called Enbrel. And were those drugs making you healthy?
No, they gradually added to the Enbrel. They added to the Enbrel, and symptoms continued to still get worse while taking it.
Okay. Right. And when you came here, have you been still taking those drugs after you came to the Goldberg Clinic?
I stopped taking the drugs a few months before coming here.
All right.
I stopped taking them.
Yeah. Why did you stop taking them?
Because they weren't really working anymore.
They weren't working. Okay.
It was getting worse.
You were getting worse. All right. Now, so we actually saw you in December. We started you on a program after we analyzed you in January for your diagnosis of rheumatoid arthritis. We found out some things from our tests that were wrong with you. Started you on a program in January, and today is March the 15th. As of March the 15th, what would you say is, so we've only been a couple months, what is the % of improvement that you now have?
I feel great.
We like to hear that, don't we, Dr. Tenner?
Yes, we do.
We like to hear that you feel great.
I feel great.
Okay, and you and I have talked about this, and is there any reason that I've given you that you should have to be sick anymore?
No.
No.
No reason.
And you were asking me today if it's going to be necessary to, not that you were complaining, but you're saying at some point, are you going to expect to have a complete relapse and get sick all over again, have to go through us all over again? And did I say you should ever have to be really sick again?
No, I will not.
Because we've identified the causes of your problems, we've addressed the causes of your problems, and with big ingredient in your success has been your hard work. And with your hard work, you have started to really be on the road to recovery, getting almost entirely well now, and we expect nothing other than continued improvement and freedom from disease.
Yes.
And once again, making health care into self-care. Thanks so much, Zelda.
Thank you.